On this occasion, let me introduce myself. My name is Putu Diayu Budicayani, along with my friend Vira Ayu Paramastri, as we want to present it about the journal article that we have read on degenerative disease. So this is the proof of the journal article, and to view the full PDF, you can scan on the barcode provided.
Okay, so reason for conducting this research. Degenerative diseases such as diabetes mellitus, hypertension, and heart diseases are among the leading cause of death in Indonesia. These diseases result from the decline in organ function, often linked to the aging process. However, the increasing prevalence of these diseases in younger age group suggests the influence of poor lifestyle factors such as unhealthy diet, lack of physical activity, stress, and smoking habit. This problem is further compounded by the double burden on Indonesia healthcare sector in addiction to dealing with degenerative diseases, infection diseases like tuberculosis and dengue fever continue to be rampant. This study aims to provide a better understanding of the causes, effect, prevention, and management of degenerative diseases. By deepening knowledge of the risk factor and mortality patterns of these diseases, this research is expected to serve as a foundation for policymakers in developing more effective prevention and intervention strategies. It is also hoped that this study will raise public awareness of the importance of healthy lifestyle in preventing degenerative diseases. Okay, next.
Next on about the research method. So this study employs a library research method, which is an approach based on secondary data analysis. The researchers gathered data from various literature sources such as scientific journal, books, encyclopedias, magazine, newspaper, and online document. The primary data was collected from academic platforms like Science Direct, ProQuest, and Google Scholar, with publication range from 2010 to 2022. To ensure the relevance of the data, the researcher used specific keywords such as degenerative disease, causes, effect, prevention, and management. This literature review was conducted without direct field observation, so the researcher analyzed article and related document to understand and categorize important information about degenerative disease. The advantage of this method include time and cost efficiency, as well as the ability to access data from various in-depth perspectives. By combining findings from different sources, the researcher can produce comprehensive conclusions regarding the causes, impacts, and management of degenerative disease.
Okay, so the study revealed that the average age of death from ENMD, endocrine, nutritional, and metabolic diseases, tends to be younger within the range of 45 until 54 years compared to DCS, diseases of the circulatory system, which typically occurs at age more than or equal to 55 years. Additionally, the number of deaths due to ENMD in the past 12 months is lower, 1 until 5 cases compared to DCS, which exists 6 cases. This suggests that DCS is more dominant cause of death, particularly among older age group. The research also found that degenerative diseases are more prevalent in women, people in the lower economic quintile, middle to lower economic status, and household with 1 until 5 family members. This finding indicates a close relationship between socioeconomic factor and the risk of degenerative diseases. Access to healthcare service, dietary habit, and lifestyle are key factors influencing the prevalence of these diseases in the community. Okay, next. So this is a video related what is degenerative diseases.
Between each of the movable vertebrae is located the intervertebral disc. This is the condition of a normal lumbar intervertebral disc. In consequence of aging or trauma, the intervertebral disc can be damaged or degenerated. Loss of disc height can cause bulging of the disc, putting pressure on the nerve exiting the spine. Lumbar disc disease can cause severe pain in the back and legs and sporadic tingling or weakness through the knees. Disc disease's treatment is intended to re-establish the height of a disc and stop movement to alleviate pain.
So last, for the conclusion, the study concludes that the risk of death from degenerative disease is higher among individuals in the middle and lower economic groups compared to the wealthier groups. This is most likely due to limited access to quality healthcare service, healthy diets, and a lack of awareness about the importance of preventing degenerative disease. Moreover, individuals in the 45 until 54 age group are at a higher risk of dying from DCS than younger age group. The research also highlights the importance of access to healthcare service. For ENMD disease, the patients are more often dying in healthcare facilities, whereas DCS patients tend to die at home. Additionally, proximity to healthcare facilities seems to have a positive impact on the management of degenerative disease. The author recommends further research using direct observational method and in-depth interview to better understand the risk factor, effects, and prevention strategies for degenerative disease, especially for younger and elderly age group. Thank you for listening our presentation.